Hi, my name is Rachel Hayworth, and I've put together a PowerPoint on respiratory syncytial virus presented as a case study with an emphasis on the top nursing diagnosis, the top nursing intervention, and what to educate the staff and family on regarding this diagnosis. At the end of the presentation, you'll find a short Kahoot just to evaluate your learning. Thanks, hope you enjoy. Respiratory syncytial virus, a case study with interventions. Respiratory syncytial virus, or RSV, is a respiratory infection that may begin in the upper respiratory tract and progress rapidly throughout the course of 1 to 2 days to infect the smaller airways of the lower respiratory tract. Initial presentation is a cough, wheezing, low-grade fever for 1 to 3 days, and decreased oral intake. Severe symptoms would be cyanosis, rapid respiratory rate, listlessness, nasal flaring, sternal retractions, and periods of apnea. These symptoms require immediate medical attention. RSV primarily affects children under the age of 2 of low socioeconomic status of any race. Now that you have some basic knowledge of RSV, let's move on to our case study and interventions. Patient demographics. Billy Pearson is a 7-month-old male. Billy's parents are immigrants from Panama. His father speaks Spanish and some English. He also smokes 5 cigarettes each day. Billy's mother speaks only Spanish. Billy's father works 2 minimum wage jobs while Billy's mother stays at home, where her mother lives with them in their 2-bedroom apartment. Billy's cousins live in the apartment across the hall. This is Billy's mother's brother's apartment, where he lives with his wife and their 3 children, who are aged 3, 6, and 8. The 6-year-old attends kindergarten in the morning, and the 8-year-old is in 2nd grade from the morning and part of the afternoon. After school, Billy's mother watches all of her nieces and nephews in her apartment, as she is home with Billy all day. Her brother and his wife both work full-time jobs to make ends meet. This is the first child for the Pearsons. Patient presentation. Billy's parents bring him to the pediatric emergency room. Billy has a runny nose, rapid breathing, is fussy, and continually crying. Both parents are at the bedside with the mother speaking rapidly in Spanish and the father translating into short English sentences. The nurse understands that this is how Billy has been for the last 4 days. His fever was max of 101.4 Fahrenheit at home. Billy is still breastfeeding, although the mother states he has had a decreased appetite for the past 2 days, and his last wet diaper was around dinner time last night. Assessment. The nurse begins by taking Billy's vital signs. She determines the following: the temperature of 100.7 Fahrenheit taken temporally, respirations of 40 breaths per minute, a heart rate of 166 beats per minute, blood pressure of 72/45, and oxygen saturation of 90% on room air. Next, the nurse performs a full head-to-toe assessment on Billy. These are her findings: general demeanor, tachypnic infant in acute respiratory distress, with flushed cheeks, rhinorrhea, chapped lips, and dry, sticky mucous membranes. Wheezing is oscillated in bilateral lung lobes with sternal retractions and noticeable increased work of breathing. The skin is hot, dry, and intact. Tachycardic showing sinus tach on the EKG monitor. Pulses are 1+ in all extremities with capillary refill greater than 3 seconds. The abdomen is soft with no tenderness or distension present. He has a dry diaper and his genitalia is intact. There is full range of motion in all extremities and response to stimulus that is appropriate to age. RSV is a viral infection, and the most definitive test is the RT-PCR. This is a nasal swab that is 89 to 100% accurate in determining RSV. A chest X-ray is performed to determine lung involvement and degree of inflammation. Billy's chest X-ray shows hyperinflation with patchy atelectasis in the bilateral lung lobes. Blood work is rarely performed in conjunction with RSV. If there is suspicion of concurrent infectious process, such as pneumonia, then blood work will be drawn to determine white blood cell count. Presented are 10 questions based on the case study we have just reviewed. First the question and then the corresponding answer with rationale will appear. Question number 1. Based on the patient's social history, which information places the infant at increased risk for RSV? Select all that apply. A. Secondhand smoke. B. Low socioeconomic status. C. Crowded living conditions. D. Patient's age. The answer is A, B, C, and D. The risk of infection with RSV is higher for infants and toddlers who are not breastfed or who live in homes with secondary cigarette exposure, attend childcare, live in crowded conditions, or are socioeconomically disadvantaged. Additionally, RSV is more prevalent among children under 2 years of age. Question number 2. Which nursing diagnosis should the nurse be worried that the patient is at increased risk for based on how the patient is currently presenting? A. Dehydration. B. Infection. C. Nutrition imbalance. D. Anxiety. The answer is A. Infants should produce approximately 6 to 8 wet diapers per day. Billy has not had a wet diaper since last night, which indicates a fluid volume deficit. Question number 3. Which of the following vital signs is most concerning and in need of immediate intervention? A. Temperature. B. Blood pressure. C. Oxygen. D. Heart rate. The answer is C. Oxygen. Priority nursing intervention is ineffective breathing. An oxygen saturation of 90% on room air indicates decreased gas and oxygen exchange and requires immediate intervention by the nurse. Question number 4. Which clinical manifestations of dehydration can be found on the physical assessment of this infant? Select all that apply. A. Chapped lips. B. Dry, sticky mucous membranes. C. Decreased urinary output. D. Sternal retractions. E. Decreased peripheral pulses. The answer is A, B, C, and E. Sternal retractions is a clinical manifestation of ineffective gas and oxygen exchange, not dehydration. All other answers are indicative of dehydration. Question number 5. What should the nurse do to ensure effective communication between the parents and the healthcare workers? A. Speak slowly. B. Utilize the hospital's licensed medical interpreter. C. Use a whiteboard for communication. D. Ask the nurse's aide, who is also from Panama, to translate. The answer is B. A and C do not address the language barrier faced by the healthcare team and the Pearsons. The nurse's aide is not qualified to translate and may not know the appropriate medical terminology to effectively translate. Question number 6. Which order would the nurse clarify with the healthcare provider ordering based on the patient's current presentation? A. Insert peripheral IV. B. Administer antibiotics. C. 0.9 normal saline IV at 100 milliliters per hour. Or D. Oxygen 2 liters per minute. The answer is B. Antibiotics are not administered for RSV. Antibiotics would only be administered if it was indicated to treat a concurrent bacterial infection. All other choices are appropriate orders based on the infant's current presentation. Question number 7. What education will the nurse provide to Billy's parents to prevent further reinfections of RSV? Select all that apply. A. Frequent hand hygiene. B. Methods of transmission. C. Risk factors. D. Importance of finishing all antibiotics. The answers A, B, and C. It is important to educate parents and patients on the importance of finishing all prescribed courses of antibiotics. However, with RSV, this is not applicable. Antibiotics would only be prescribed if there was a concurrent bacterial infection. Which medication would be administered for high-risk children as a prophylactic prevention measure for RSV? A. Cefepime. B. Acetaminophen. C. Palivizumab. Or D. Penicillin. The answer is C. Prevention of RSV is available via a monoclonal antibody, palivizumab, given in monthly intramuscular injections. This medication is started at the onset of RSV season and is terminated at the end of the season. The season normally lasts from November through March. Question number 9. The atelectasis on the patient's X-ray is caused by which of the following? Select all that apply. A. Buildup of mucus. B. Smaller airways of the lower respiratory tract in children. C. Infection. D. Decreased oxygen saturation. The answer is A and B. The smaller airways of the lower respiratory tract in children, especially those under 2 years of age, result in rapid buildup of mucus which manifests as atelectasis on a chest X-ray. Infections such as pneumonia can cause atelectasis to appear on a chest X-ray as well, but that is not the case with this infant. Decreased oxygen saturation is a result of atelectasis, not a cause. Question number 10. Which intervention will the nurse implement to monitor output? A. Insert a catheter. B. Document how many wet diapers a day the infant goes through. C. Weigh the diapers. D. Assume the infant will have an output equal to intake and document this number. The answer is C. Weighing wet diapers is the best way to accurately measure the infant's output. It is important to document how many diapers per day the infant dirties, but it is not the most accurate way to determine output. The insertion of a catheter places the infant at an unnecessary risk for infection and is not indicated, and it is never safe to assume. Education is an integral part of nursing. We will cover the top nursing diagnosis to educate the patient and family on, as well as the most important nursing intervention. The nursing diagnosis. Top nursing diagnosis is ineffective breathing pattern related to possible viral pathogen as evidenced by increased work of breathing. This is the top nursing diagnosis as oxygen is imperative to the body's cells to maintain life. Billy from our case study is already demonstrating increased work of breathing, as evidenced by the sternal retractions and nasal flaring. Billy's vital signs also show this increased work of breathing with 40 respirations per minute and a decreased oxygen saturation of 90%. Education for the family. When educating the family of Billy on this nursing diagnosis, it is important to utilize a licensed medical interpreter as the family is primarily Spanish-speaking. This will allow for effective communication between the nurse and family. First, explain that RSV is a highly contagious disease spread by droplet or contact with infected surfaces. This virus affects the smaller airways of children 2 and under, causing the lungs to not be able to effectively perform the gas exchange of carbon dioxide and oxygen needed to breathe. Billy is showing signs of this with his increased breathing and the effort he is putting into breathing. Oxygen may be applied via a humidified oxygen tent to increase Billy's ability to take in oxygen. When Billy's breathing improves, he should be able to come home. Then educate the family about transmission methods as well as prevention of RSV will also prevent further readmissions to the hospital for this virus. Finally, provide written materials in Spanish for Billy's family regarding RSV, prevention, treatment, and what to do if Billy should catch the virus again. Specifically, when to seek medical attention. As Billy's family is of lower socioeconomic status, information should be provided about local community resources that may help the family with unexpected medical expenses, childcare, emergency funding, as well as well-child checkups. A priority nursing intervention. Assess for airway, for patency, respirations, and breath sounds. This is a priority nursing intervention because without a patent airway, the patient will cease to live. Assessing respirations and breath sounds allows you to determine how serious the ineffective breathing is. Education for the nurse. Education for the nurse is focused on assessing the lungs and airways. First, note how much effort the infant is putting into breathing. In Billy's case, there are sternal retractions and nasal flaring with rapid respirations. This demonstrates that there is a problem with oxygen exchange. Next, place the infant on a pulse oximeter. This determines oxygen saturation. If the oxygen saturation is less than 90%, the provider should immediately be notified. Rapid interventions and orders will be needed to prevent further desaturation. Then, auscultate the lungs and all lung lobes, both posterior and anteriorly. When the nurse auscultates, she will find the wheezing present bilaterally, further supporting the decreased gas and oxygen exchange Billy is suffering from. From here, the provider should be notified of your findings, and Billy should receive orders for nasal suctioning, oxygen, and IV fluids to thin secretions. Lastly, reassessment is required frequently to determine the effectiveness of interventions and ascertain if further interventions are required to improve the patient's condition. Kahoot. In the live environment, an interactive Kahoot would be presented at this time. As it's not possible, the following is 5 questions to be used as a self-evaluation tool on the contents of this presentation. Question will appear with answer selections, and then the correct answer will become highlighted after a period of time. Question 1. Which of the following is not a symptom of RSV? Cough, increased oral intake, fever, or wheezing? Correct answer is increased oral intake. Question number 2. Anyone can catch RSV. True or false? True. However, is more prominent among children under 2. Which vital sign indicates potential dehydration? Temperature of 100.7 Fahrenheit, respirations of 40, blood pressure 72/45, oxygen saturation 90%. Correct answer is blood pressure, 72/45. Question number 4. RSV requires antibiotics as part of the treatment plan. True or false? False. Antibiotics are only administered if there's a concurrent infection with RSV. Question number 5. The first intervention is to assess airway, respirations, and breathing. True or false? True. Remember the ABCs: airway, breathing, and circulation. Thank you for your time listening to this presentation. Have a great day.